Welcome to Cascadia Eye's LASIK informational meeting. You must be here because you want to learn more about how you can be free from glasses and contacts. When I made the decision to have LASIK surgery over 20 years ago, my main concern was, is it going to hurt? And how long will it last? The industry information tells us now that the most common concerns people have are fear and costs. So we hope to address all of these issues for you, plus answer any other concerns you might have. Cascadia Eye has been providing total eye care here in Skagit Valley since 1985. Dr. Pereira, who is leading this meeting today, is a board-certified fellowship-trained cornea specialist and has been with us since 2010. He's agreed to carve out a little time of his evening to teach you about LASIK and answer your questions. You can put any questions you have in the chat as soon as you think of them. You don't have to wait, and our moderators will make sure Dr. Pereira addresses them. At the end of Dr. Pereira's presentation, we will give another opportunity for questions, and I will provide information about costs and financing. And finally, Christy, our marketing coordinator, will give you some final information regarding next steps and say goodbye. So let's get started. Dr. Pereira, you are on.
Thanks so much, Sheri. I'm just going to open up a presentation here as we start out. And very good. So yes, I'm Carlindo Pereira, one of the refractive surgeons here at Cascadia Eye. Thanks for joining us this evening. And the refractive surgeries that we perform are LASIK, PRK, and RLE. For this evening's webinar, we'll be talking about LASIK and PRK. When you inquire about refractive surgery, um, we have information we want to share. We're excited that we have our very own laser center right here in Mount Vernon. And this is in our Market Street location where the procedures are done, both LASIK and PRK. And as you inquire about information, whether it's through a phone call or if you've been referred by an outside optometrist or you've done the online self-test for refractive surgery, there's certain information that we need to gather to see whether you are a good candidate for the procedure or even for a further workup or evaluation. The information that we need is what your refractive area is, whether you are nearsighted, farsighted, have astigmatism, and how big that refractive area is. It's also important to know if your refractive area has been stable. And so we will ask for information such as your glasses prescriptions, especially the last 3 to 5 years. That gives us very valuable information. We also want to know if you wear contact lenses because it's very important to be out of your contact lenses before doing a workup for a period of 2 weeks. We also want to know a bit about your age. Currently, refractive surgery is FDA approved for patients over the age of 18, but ideally we're thinking more around 21. And I usually tell patients by the time you're done with college, is a good time to consider refractive surgery because at that time you're more likely to remain stable. While we're talking about age, we're also looking at the other end of the spectrum. So if you're in your 40s or 50s, considering refractive surgery, if you're perhaps nearsighted and we improve your vision for distance, you'll now need glasses for reading. And that's important to know, unless we do something like a monovision, which we would first see whether you can tolerate. We also gather some information about your medical history, medications. And so in general, looking at certain conditions, ideally no autoimmune diseases, or there's some that we will allow as long as they are well controlled on medications. Previous history of infections or injuries to the eye that could perhaps cause scarring on your cornea would make you a poorer candidate. Of course, we do not do this during pregnancy, do not do the evaluation, or while you are nursing. We wait for a couple of months after you've stopped nursing before we would do an evaluation. We want to make sure you're stable and normal cornea, as we've mentioned, and that you understand what you will get with your vision depending on your age and whether you would lose near vision. So the refractive consultation, right on the top right, there's just a little picture of our Little Mountain location, and that's where the consultations are performed. This is a long appointment, so you're probably going to be here for a couple of hours, and we do a lot of testing. We do a refraction, a glasses check just to make sure that your refraction looks stable. Lensometry means we read your current glasses prescription. We do additional topographic images of your cornea using both the pentacam and the atlas images just to make sure that the cornea is a normal shape and that you have adequate tissue in your cornea for the prescription that you have. Pachymetry just means the corneal thickness that we look at your pupil size, the curvature of your cornea. And what's different about this appointment is that when we dilate your eye, this is different to a dilation that you may have had as part of an annual exam. We use very strong dilating drops, which could last a couple of days. And the particular reason for this is we repeat the refraction when you are dilated. This is called a cycloplegic refraction. You may have, if you're nearsighted, you may be aware that there may be times that you've maybe been overcorrected, whether it's with glasses or your contact prescription. What a cycloplegic refraction achieves is eliminating that possibility of overcorrecting you when we do your glasses exam or your refraction. So it eliminates your eye from trying to do some of the focusing while we are doing your refraction. Here's just an image of a pentacam and just some of the detail that we get. We get the corneal thickness measurement. We look at the front and the back of the cornea, make sure that the shape is normal. And I've just put in another slide here of an abnormality. So this cornea in the bottom left image, just looking at the corneal thickness, this measures 491 microns, which is a slightly thin cornea. And then the top right image looks at the front curvature. There's a little bit of an elevation. And then the bottom right image looks at the back elevation of the cornea. And you can see that there's little round orange area that looks like a sun. And that is a cornea that is not a good candidate for refractive surgery. So these are the things that we look for during the consultation. And another image here. And in this middle section, you can tell that red area again where there is a posterior elevation, or we call that a posterior float as well. And that would be a patient that's not a good candidate for refractive surgery. After that appointment, if it looks like you're a good candidate and you decide to proceed with surgery, I do bring you back for a second exam. The second exam is what I call a dry refraction. This is a short appointment, and I recheck your refraction at that visit and compare it to your refraction when you were dilated. This second appointment is very important because I use this refraction to fine-tune your actual treatment on the day of your surgery. It's also important to not wear contacts for 2 weeks prior to this appointment. And then for the big day, when you come in for your procedure, once again, you have to be out of your contacts for 2 weeks. If you wear your contacts, even for a short period, that has a slight molding effect on your cornea, and then you will not get as good vision result. When you come in the day of treatment, we get another scan on your eye. This is an eye design image that's used. You will, at that point, already have picked up prescription eye drops. There's a pain medication and a Valium that you will bring into that appointment. Once we've achieved a good scan, good quality scan, then we will let you know when's the right time to take your Valium just to help you relax. And you need a driver that day, whether you're getting LASIK or PRK. So we bring you into the laser room, and we use numbing drops to help you so you don't feel pain during the procedure. We clean your lids to minimize the risk for infection. In the image below, you'll see that there is a surgical bed between two lasers, And that's pretty much what the setup is like in the room. That bed does swivel between the two lasers, and I'll show you what these look like a little closer. For LASIK, the first laser is called the intralase. This is a femtosecond laser, and this is a laser that creates the flap in your cornea. On the bottom edge of this image, you can see there's a little cone-like structure, and that is what is used to approximate your eye. So we put a plastic suction ring on your eye, and that cone is lowered down, and we dock the cone right onto that suction ring. Once your eye is aligned with the laser, it takes less than 20 seconds to create the flap. So during this procedure, it's very normal to feel pressure, and sometimes your vision can dim out a little bit. And this is probably the most uncomfortable part of the procedure. Once the flap is created, we then move the bed over to the second laser, which is the excimer laser, and that's the one that reshapes your cornea for your treatment. You'll notice that there is a little wire speculum that keeps the lid open, and so you don't need to worry about blinking because you'll not be able to blink on the side that we're operating on. And you're really just going to see a bright light. And we talk you through it, let you know where to look. We do continue to use numbing drops during the procedure to keep you comfortable. You may feel a little bit of tugging during the procedure. And once we have your eye lined up to the second laser, the treatment varies on how big your prescription is, but it could vary between 20 seconds and 30 to 40 seconds to do your treatment, and that is per eye. This diagram just shows again the procedure. Numbing drops on the surface, a flap is created and lifted, a laser reshapes your cornea, the flap is repositioned, and that is the end of the treatment. And this photograph on the left showing LASIK with a flap that is lifted up, and the one on the right is PRK where there is no flap. And so the question is, well, why PRK? There are a few reasons why some patients may choose to have PRK. Either their cornea is too thin, there's not adequate tissue for LASIK, or perhaps the cornea has got some mild irregularity or mild abnormality in its shape, and PRK would be a safer option for that patient. There are some times that patients request PRK either because they've had family members have PRK or depending on their particular occupation, particularly people who are in law enforcement who concerned they may be assaulted, or people who are in contact sports and choose to not have a flap may choose to have PRK. The difference in PRK, again, there is no flap. We do remove the outer covering of the cornea, which is called the epithelium. And that same excimer laser that we use during LASIK to reshape your cornea is used during PRK. And in this image, you can see the eyes being held open with a speculum again, and just some of that last epithelium is being removed. And that's one of the big differences between LASIK and PRK is, as you can imagine, when the epithelium is removed, this can be very painful, but not during the procedure. It's painful when you're at home, once the numbing has worn off. So in recovery, the first couple of days, you'd be taking prescription pain meds with PRK, and that is different to LASIK. So after surgery, it's important to use eye drops, which we do prescribe. For LASIK, you'd be using prescription drops for 2 weeks. For PRK, prescription drops are used for much longer. That's for a total of 4 months. It takes a little longer for the cornea to heal with PRK. We do check your vision each time when you come in for your post-op appointments. We also do some refractions certain periods during your post-operative time. And during your post-op appointments, our goal is to have minimal waiting time as you come in for these appointments. So what to expect with restrictions after surgery? Time off work depends on what you do for your occupation, but in general, for LASIK, patients take 1 or 2 days off and are back at work. Unless you work in construction or landscaping where you in a dirty, dusty environment, then you'd have a week off from work. PRK patients all take a week off from work, and sometimes 1 or 2 weeks if you are in that dirty, dusty environment. And this is important also to consider chores. So when patients are either taking care of animals or doing yard work, I have them avoid that for at least a week after surgery to minimize the risk of infection. This also includes no swimming or hot tubs for 2 weeks to minimize infection risk, and also uh, no no makeup or eyeliner for a couple of weeks for the same reason. So right after LASIK, it's quite common for vision to maybe be just a little bit hazy, almost like you're looking underwater. But later in that day, as the swelling comes down, the vision does clear up very nicely, and the next day, majority of patients have very clear vision. The vision's a little different in PRK. It varies between patients. There are patients who on day one, see very well, but it's very often vision takes longer to recover with PRK. And most patients with PRK are not driving that first week. But as the eye heals, at a 3-month mark, there's no difference in the outcome in vision whether patients had LASIK or PRK. And of course, the goal is to not be needing glasses or contacts for distance. But earlier, I did mention about looking at a patient's age. And so if we do correct your vision for distance, and your vision remains clear, when you reach your 40s or 50s, you will then need glasses for reading, initially for reading, and then later for computer as well. And that aging process in the eye is called presbyopia, where the lens in the eye loses its ability to change shape and we lose our near vision. This is just a picture of our surgical team. So to my right is Melissa, who helps me in the surgery during the cases. And to my left is Claire, our surgery coordinator, and Katrina, who both help get those images, those final scans on the day of the treatment. Our technicians are very experienced and they also have great attention to detail. So I can confidently say that you're in good hands with our team and we'll take great care of you. And just want to check if there are any questions.
I can go ahead and move on, being there are no questions, and talk a little bit about costs and financing options. I'm going to share a little information on my screen while I go over it. So our pricing for LASIK with Intralace, that's using the 2 lasers, is $2,500 per eye. And for the PRK, which as he explained is using just the 1 laser, that is $1,800 per eye. This includes your preoperative visits, including that long one Dr. Pereira spoke of, and your postoperative care. And I believe that's for a full year. Someone can jump in and correct me if I'm wrong there, as needed. The laser surgery itself, of course, and then we just, because we have some cool stuff, we just throw in a new pair of sun lenses. Now, these are just the lenses, but they don't have a prescription because you won't need that anymore. So that's just a lot added extra we do for you. But what's really exciting is we have started, and we're doing it for a limited time, to offer 0% in-house financing. So what that means to you is you can break this up. Let's say you got LASIK with Intralace for both eyes, 5,000. I should have done my math, but it's just a little over $200 per month for 24 months, no interest. You're not having to make an application to any lending company. We do it in-house. So all we ask of you is that you put your debit card on file with us, and then we just automatically take out that monthly payment for you until it's paid. You can opt to do it sooner, of course. If you want to do anything less than 24 months, we can do that as well. So we're really trying to make it like it says there. We don't want finances to be the reason you can't get LASIK surgery. Thank you for joining, and we hope to see you soon.